I didn't expect it to be easy, but I sure didn't expect it to be this kind of overwhelming and complicated with so many barriers in place.
This is a woman you will be meeting in just a couple of seconds, using her voice to advocate for more mental health care and coverage, a story that a lot of families can relate to. She is just one of few people that Denver 7 spoke to in support of a proposed bill trying to make it easier to get mental health care.
Denver 7's Allie Jenner-John looked at the bill. It's aimed at getting families the treatment they need, and especially when their health plan breaks promises.
Exactly. And to put it simply, there's a lot going on here, but bill sponsors are trying to establish a standard definition of, quote, medical necessity. This, sponsors hope, will put mental health treatment needs and decisions back in the hands of doctors and patients and limit an insurance company's option to deny coverage. Mona Abaza knows that denial too well. She tells me she and her husband have spent over $350,000 out of pocket, still counting, to get their daughter mental health care. Their daughter, now a freshman in college, has scars from self-harming, has been to 4 different programs over a year and a half, and the family has evaluation notes from psychiatrists who at the time didn't feel it was safe for her to stop with those programs. Still, Abaza says their insurance denied them coverage, claiming their daughter was not a danger to herself.
We had the resources to take out a second mortgage and multiple other loans so that we could get my daughter the care she needed to thrive again, which I am blessed to say she is. But most families in Colorado are not. So I think it's really important that we view mental health the same way we do physical health, and that our insurance companies do as well.
Now, on the other side, there are some legislators less on board with this bill, arguing it's not their place to meddle in contract work between insurers and insurance carriers, saying it should instead, Nicole Nanusha, be an issue looked at by the AG's office or Division of Insurance.
Well, not just the amount of money they've spent, but this has been a years-long battle for this family you mentioned. And were they able to get any coverage at all? I mean, can people rely on their insurance at all here?
Yeah, I mean, it's possible. And this family did get a little bit. In Abaza's daughter's case, she tells me they got about 1/4 of the coverage. That's because the insurance chose outpatient care instead of inpatient care, even though her daughter was in a residential program. She says some psychologist bills here and there were covered, but certainly a long way to go. I mean, they had 1,500 pages of documents battling with their insurance. They just got their last denial for their final appeal in December.
You just think about these are what families are dealing with in the middle of a crisis, trying to get their kids better. So
glad to hear that their daughter is doing better. Though.
Thank you, Allie. Well, in years of covering this issue, one of the things that has really stood out to me over the years is the shortage of beds for kids, especially for children who need that more intense and long-term care. It's to the point that some kids are actually sent out of state for their care, away from the support network, away from what they know. It's an issue that is repeatedly brought up at the Capitol and through different groups, which is a sign of just how complicated it is to address this crisis.